So she put the right leg back. And then you want to try to have them push the heel into the ground, and then they can kind of lunge forward, keeping the back leg straight. And just watch that they're actually keeping their foot in alignment, because sometimes they're going to toe out or toe in, and that's going to affect how it's being actually stretched, and it will bias one side versus the other. So try to get them to understand and keep it neutral. And then to get the soleus, then you would do a bent knee version of this stretch. 3 times 30 seconds is generally the rule of thumb. There's different evidence out there, but a lot of the evidence I've read says a minimum 30 seconds to actually make a change in the length of the muscle. So this is a really good stretch to have them do. The other one that I like is to actually use a wall, where it's kind of hard to do it barefoot, but if you have a shoe, they get the grip on the bottom of the shoe, and then they push off the back, and then they lean into the wall. And that gives a lot more stretch. Yeah, let me show you. Here, go ahead and use my shoe. So you would step basically on the wall with your shoe, and then you want to push off your back leg. And I give them a cue to do belly button to the wall, because otherwise people want to do like chest, and they're going to feel more hamstring with that. So if they actually push off, they get a really good stretch in both the gastroc and Soleus with that one, but knee and straight. And you would just have them go through the full range of the heel raise, pushing up and back down. And if they can tolerate that, which most people can, you would then have them go into a standing position. And I'll usually have them stand at a table just so they can use their hands for balance. And just make sure they're not really leaning into their hands, that they're actually using the body weight to push up and down through the hips. So another thing in the evidence, so tendinitis versus a tendinopathy, a more chronic, non-inflammatory problem, a lot of the evidence shows that working on the eccentric portions, so actually slowly lowering, helps a lot more with the tendinitis and tendinopathies. So when the patients are doing this, a lot of the time they're really good about pushing up, but then they just kind of fall back down and they lose the eccentric portion. So you want to make sure that I tell them to actually just come up and then count to 3 on the way back down, and make sure they're really concentrating on the eccentric portion. So that's the way to kind of work on that. And usually, okay. So first one I would have them do is plantar flexion, dorsiflexion, just because they will probably be able to do a fair amount in that range, and just to get them moving the ankle and not keeping it very stiff, because a lot of them are afraid to move it. And then working on inversion and eversion. So one thing that you'll see is a lot of the time he'll want to move the whole leg instead of the actual ankle. So just make sure that they're stabilizing the leg and truly moving the ankle with these. I would say definitely pain-free, especially if it's an acute injury, just trying to get a little bit of motion in the ankle. The other one that we use a lot is the alphabet, so just going through and writing the alphabet with your ankle, big capital letters, and that way they're getting all the motions in the ankle. And then we would do the gastroc soleus stretching that we showed you before, and the other one that we work on is the balance training. And what you're looking for with this, sometimes if they have really poor balance, you'll see patients kind of start to do this sort of thing with their upper extremities, because they're keeping their ankles so rigid and stiff. And you want to kind of see the ankle working to do the balance instead of the upper body. So I'll have the patient kind of focus on keeping everything really still from the hips above, and try to use the foot to maintain the balance versus your upper extremities. So if they're able to do that pretty well, you can have them move the arms. You can have them go into the other thing this way. And then if they have a ball or something, I'll have them do circles just to change the center of mass. And then the third part would be a tennis ball or something that they could just throw on the wall and then add more dynamic stability with balance. Yeah, so for one you can do just basic toe extension, so kind of pulling, they can pull all their toes up and then kind of work on flexing down. And you can, if you cross your leg, you can just do it like a self-exercise. So I'll have my patients do this, count for 2 seconds in each position, just to start mobilizing the fascia. The other one that we use a lot in PT is, the water bottle. So you guys have probably seen the water bottle or tennis ball to use for mobilizing the plantar fascia. The water bottle is helpful because you can actually ice the water bottle, so you're getting an ice treatment. And you just basically will put it along here, along the actual fascia. Okay. So you can just you basically just have them step on it and just roll along the fascia. And I'll usually have them do that for about 3 minutes. Usually it's pretty tentative. Posterior strengthening, you could first start out with just toe curls, and sometimes it'd be better if there's like a tactile feedback, so putting a towel or something on the ground and then having them try to grasp the towel, and that will start to work posterior tib, and then you could turn it into more of like a wiper, called windshield wipers, where they're pulling the inversion with the toe curling. And they'll generally start to feel it in the medial arch. So 2 sets of 15 is generally what I would do, or 2 sets of 10, just depending on when they start to fatigue. They can also do toe curling, like marbles or things, where they pick up items and then try to drop it in a cup or something like that, just to add into a little more of the contraction. So those are all good posterior tib strengthening exercises. The other one that I like that's really functional, once they show that they can actually do that, is to stand and then try to do that same contraction where they're lifting the arch and getting the posterior tibs. And then if they're able to do that with both legs, then to go into kind of a balance activity and then maintain the arch. And they'll generally feel that right through the arch. It gets kind of achy. So if they can hold it, I say they can do about 10 seconds, and they can do that 3 to 5 times, and that's a pretty good level of function for the posterior tib.
Do you ever have them take the